Emotionally preparing for surgery. This is an extremely important topic that we probably don't talk about nearly enough because it can have such a huge bearing on your post-operative course and how everything goes. So I'm gonna take this opportunity to do a little, well, not a beach walk today. I'm in one of these lovely gardens they have here in the Azores. So we're gonna take a garden walk and talk about emotionally preparing. So I'm going to give you a few tips. Number one, education is our friend. Being mentally prepared in terms of thinking through everything, reading everything your surgeon gave you, thinking about and asking every question you can think of is very important because all of that knowledge insulates us in the postoperative period when we start to experience things that are concerning. You're having swelling, you're having bruising. Is this normal? What do you do about it? Going in with the necessary knowledge helps make everything easier and will get you through those rough periods so much more smoothly if you know what to expect. Additionally, talking with your surgeon frankly and sitting down and going through your expectations, your questions, your concerns, this sets the stage mentally for you trusting in that person and letting go. You have done your research, you have selected your surgeon, you are putting complete faith and trust in that person to take the best care of you they can and to give you the absolute best result. And now at this point, you have to make the jump and say, yes, I trust this person. I'm going to listen to them. I'm going to keep open communication and I'm going to let go. Number two is thinking about your goals and writing them down. Journaling can be a very, very important tool to use in terms of sorting through your thoughts and ideas before and after surgery and getting you through that postoperative period. But even if you're somebody who absolutely hates the idea of journaling, I ask you to write down one thing, and that's before surgery, think about what is it that I want to get out of this? And write it down. And then tell your surgeon, especially that morning of surgery, say, hey, I really thought about it. And the one thing I really want is to get rid of this heaviness under my neck. Or the one thing I really want is to just not look so tired. And that's a nice way to keep our eyes on the prize. It's easy in the postoperative period to get caught up on every little thing, every little stitch that may not have completely healed yet, every little area of swelling or fullness. But if you can go back to that goal and say, wow, I'm only 2 or 3 days out and I'm crazy swollen and I have bruises, but my jawline is so much better, or my neck already looks better, or I don't look nearly as tired as I did before surgery. Number three, have a support person. So I know a lot of times patients don't tell a lot of people that they're having surgery, which is totally fine. But I ask that you have one person, whether it's a friend or a relative. It does not need to be somebody with you physically after surgery. Somebody who's only a phone call away is just as good. But you need somebody who knows and who you can talk to frankly and honestly about the whole recovery process. And it's most important that there's somebody who oftentimes just listens, but a lot of times they can help reorient you and bring you back to that goal, or just make you feel better by allowing you to vent and get everything off your chest how you're feeling. A word of caution, this person often isn't a husband. Husbands are great. Husbands are super important for the recovery process, but specifically for this thing, they sometimes have difficulty, maybe because they're too involved in being a neutral sounding board or somebody that just listens. So your support person may be different than the person who's taking care of you on the day-to-day. Number four is manifest success and let go, meaning tell yourself you are going to have the best results anyone's ever had. You're going to fly through this recovery. you are doing amazing even before you've started. Because, first of all, it's true. And second of all, if you can keep your mind in that frame, you will do better. My patients who have this attitude, I've noticed, have less anxiety because that it keeps their blood pressure down. They have less bruising and swelling. They seem to be back to normal activities more quickly, and it's simply because they're keeping their eyes on the prize. They are not getting caught up in all the little details, and they are manifesting this result that ultimately comes true. And so, if you can keep your eyes on the prize, you will have such an easier recovery course. And your support person sometimes can help you do that as well. But emotionally, there's no doubt about it. Emotionally, the recovery from facial surgery, especially facelift and neck lift, is a big deal. You look different. You see a different person when you look in the mirror, and you will go through a period where you don't know who you are. And so it's important to prepare for that mentally and emotionally, and know that on the other side, you're going to be the best version of yourself, and you're going to get through this surgery. So, thanks for coming on my garden walk with me today. If you have any other ideas or topics you'd like to hear me talk about, please leave them below. Thanks.